Hey, welcome. Today, we are diving into something we all face, those really tough choices that don't have a simple black and white answer. We're talking about the tricky situations at work, in life, and especially when someone's well-being is on the line. Let's get into it.
And our mission today is really to decode that ethical blueprint. We've been diving into a stack of source material detailing the frameworks for right versus wrong in professional life.
Especially when the stakes are highest, like in healthcare.
Exactly. We want to give you, the listener, a clear roadmap to navigate not just these big challenges, but the everyday ones too.
All right, let's kick things off with a classic. Picture this. You're the boss. You just hired an absolute rock star. They're amazing at their job, and there's definitely a spark between you two. You're both single. So, what's the move? That little knot in your stomach, that feeling where what you want to do and what you should do are at war, that, right there, is the heart of an ethical dilemma.
Now, let's quickly test your ethics IQ with some of those sticky, everyday dilemmas.
Ooh, I like this little quiz.
A quick brain break. So grab a pen.
All right.
Okay, let's go back to that first one. New hire attraction. You're attracted to your new hire. You're both single. What do? Option A, ask them out. That's 1 point. Option B, maintain a strictly professional relationship. 3 points. Or option C, discreetly pursue a romantic relationship. Keep it quiet. 2 points. Okay, next one. Confidentiality breach at a restaurant. You're out to dinner, you overhear two colleagues publicly naming a client and discussing confidential information.
Oh, that's a bad one.
A is, ignore it, it's awkward, they should know better. 1 point. B is, talk with your colleagues privately about your concerns right then and there. 3 points.
And C.
C is, immediately report them to your supervisor the next day. 2 points. Okay, final one. The always tempting corporate card dinner. You took your family out, forgot your wallet, and used the corporate card. What's the move?
Oof.
Option A, put a fake client name on the expense report. 1 point. Option B, mark it as a personal expense and reimburse the company immediately. 3 points. Or C, tell your supervisor it was a missed family dinner and ask them to approve it because you've been working so hard. 2 points.
Yeah. Okay, so if you chose B, you scored the highest. The research really highlights how this tests the respect to others principle.
How so?
Well, even if a relationship is technically allowed by company policy, pursuing one immediately creates a power imbalance, a conflict of interest. It could jeopardize their career path, no matter how great the chemistry is.
Right.
So the highest score is B.
Yeah, why not just go straight to the supervisor?
Well, while reporting them sounds like the safest move for you, B actually aligns best with make things better and respect others. You address the issue at the lowest possible level first.
So you give them a chance to fix it.
Exactly. A private conversation stops the breach immediately and gives them a chance to correct themselves without, maybe escalating to serious professional damage. That's the ethical preference. It has to be B, right? It's the only move that upholds be fair and be honest.
Absolutely.
Right.
Option C is so tempting because it feels like you're owed something, but
that's just moral rationalization. It's not ethical conduct.
So let's tally those scores.
Yeah.
If you landed between 5 and 8, you might be leaning towards, convenience or self-interest.
If you score a 9 to 13, maybe you're a bit inconsistent. You know the high road, but sometimes you choose the easier path.
But if you hit 14 or 15 points, that means you have a highly developed sense of integrity. You consistently choose the action that upholds that universal code.
That general framework is so critical for any job.
Ethics, you've heard of that, right? We all have them, or at least we think we do. But when it comes to the workplace, what you say or what you do could have a major impact on your career. Here to put your business ethics to the test is Bruce Weinstein. He is ethics columnist for Business Week Online, and he has some great questions for us. Bruce, great to see you.
You too, Jerry.
All right, I'm going to read the question.
All right.
I'm going to tell you what I think, and
Okay.
then you can tell me where I don't have ethics, okay?
Maybe you got them all right. Who knows?
All right, number one.
Okay.
Someone you've just hired seems to be attracted to you, and you're attracted to them. Both of you are single. Would you A, ask them out on a date, B, have only a professional relationship, C, ask the person if your intuition is correct, and if it is, discreetly pursue a romantic relationship? Okay, So, Bruce, I have to tell you, everybody dates people in the workplace, but everything's different, I think, if it's your boss or someone who's working for you.
Well, just because everyone does it doesn't make it right?
Well, wait a minute before you go there. I think the choice that I would make is not even in those choices.
What is
I
that?
would say, wait it out. If it's that important to you, maybe you change places in the organization so that you can date that person.
That probably is the best way to go. Of the three choices, though, the right one to do is B, have a professional relationship only. Because let's face it, most relationships don't work out. How many people do you know who are married or in a relationship to the very first person they ever dated? No. So when this relationship fizzles at work, you're going to feel uncomfortable, the other person is going to feel uncomfortable, and one or both of you may have to go because the company, their reputation is at risk, and your obligation to clients may be hurt.
Well, and especially because it's employee-employer, the direct report relationship, that makes it more complicated.
Well, and it also opens the door to sexual harassment if there's an imbalance of power.
Maybe a
So there are
lawsuit.
legal as well as ethical issues potentially.
All right, number 2, at a family dinner out, you use your corporate card because you forgot your personal one. When it comes time to do your expenses, you A, put in a client's name whose account has plenty of cash in it, B, mark it as a personal expense and reimburse your employer, or C, ask your boss to approve it because with all the late nights you work, you've missed a lot of meals with your family. Okay, Bruce, my answer is C. If you do work late nights, I mean, come on. Maybe it makes sense to see if you can expense it, but I would disclose.
Not the best of the three, because
No?
there are two ethical
I'm wrong?
concepts. Well, in this, unfortunately, yes.
Okay.
Because there are two ethical concepts at stake here: honesty and fairness. And you are being honest by being upfront with the boss, but other coworkers presumably worked long and hard, and if they don't get the perk, it's unfair to them. How are they going to feel?
Well, what if I negotiate my own perk, Bruce? Does that, I mean...
But again, you have to think about, or at least the person who's authorizing this has to think about how this will affect the morale of everyone, and also really what's fair. You have to treat like cases alike, unlike cases unlike.
All right, so you just have to pay for the dinner yourself. All right, number 3, in a public restaurant, you overhear colleagues discussing confidential client information and mention the client by name. Would you A, ignore it, B, talk with your colleagues about your concerns and leave it at that, or C, report them to your supervisor? This is tricky.
Yes, it is.
I think the problem is that it's already happened. It's out there.
Yes.
You can't correct it. I don't want to go to the boss because I don't want to tell on them.
But can't you prevent future occurrences if these folks were to have such
I would talk to them.
That's right. Talk with them and leave it at that. Because if you do nothing, as Edmund Burke said, all that is necessary for evil to flourish is for good people to do nothing. So it allows a problematic situation to continue. And if you blow the whistle, that's probably too harsh a response. Unless your company requires you to inform them, talking with them in most cases will take care of the problem. Just bringing it to their attention is enough to put an end to it.
Are there any basic rules of thumb you would tell people in the workplace, ways of making these decisions without having to consult someone else?
There are 5 basic principles. Do no harm, make things better, respect others, be fair, and be compassionate. And these are principles that apply not just in business, but in every relationship and in every social context. And these are the principles that apply in medicine and law as well. So these are 5 basic rules. And by the way, we put this quiz on the AC360 blog, so viewers can go to that, take the quiz, and there are a couple of other questions too.
Bruce, thanks for your help today.
Thanks,
we really
Jerry.
appreciate it.
So how do you even begin to navigate that kind of tension? Well, the first step is to understand the huge difference between our gut feelings, our own internal compass, and the official rulebook. Because it's not always about what feels right. It's about following a code.
Yeah, this image really nails it, doesn't it? The solution to our little workplace romance problem isn't just about following your heart. It's about looking at a bigger, more structured framework. And to even start building that framework, we gotta get our terms straight.
Okay, this is so important because we mix these words up all the time. Morals. Those are your personal rules. They're your internal code, shaped by how you were raised, your beliefs, your experiences. It's what feels right to you. But ethics? That's different. Ethics are external. They're a shared set of principles that a whole profession agrees on to make sure everyone plays by the same rules and maintains a high standard, no matter how they're feeling that day.
I think as philosophers, we're very invested in what it means to give an account of a good life. And one of the doctors told us this, I think, really wonderful story.
I had a patient several years ago that was admitted for gastrointestinal bleeding. He was on a blood thinner, and he was put on this a few years after he had his heart valve replaced.
And so the doctor went to go check in on the patient, and the patient was staring out the window. And when the doctor asked them what was wrong, the patient answered that
he'd been lying there thinking about what they had done to him, as in put in this valve, put him on this medicine that he was stuck on for the rest of his life. And the whole time this was going through his head, he was looking out the window and watching the lights up on the hill, blinking. And he got frustrated because
the blinking of the light was out of sync with the ticking of his mechanical valve, and that it was driving him insane.
And then he went on his way, and the surgery was a success, but for him, on some level, the whole thing was a disaster and it was a failure because his life was now different in a way that he never had conceived was possible.
When the path isn't clear for a patient, when principles are in conflict, it's not so much my job to say, this is the principle that we should be following. It's to help the family or the patient to understand, help them find their good, and then I can unpack that in terms that other people can understand.
Clinical ethics, it focuses on ethical problems that tend to emerge within a hospital setting. My class has nearly half of the students being human physiology majors and biology majors, and on the other hand, we have philosophy students that are doing a lot of work in the humanities in general.
One of the biggest criticisms I get about things like medical philosophy is that's not actually how it works. That's not how it's applied. Well, this class kind of takes that into consideration.
To dive in and, we'll have this conversation.
I remember there was one meeting where I kind of just had to sit back and be like, maybe I'm wrong. Maybe I'm wrong in that kind of thinking that informed consent is what we should strive for as a medical society. And that was directly after a conversation with Dr. Raj Alexander.
Informed consent to me as a hospitalist, a practicing physician, is about getting into partnership with the patient so that they agree to the treatment that you're going to give them. They need to know what those effects are, why you're giving them to them, what the alternatives are, what the risks are, and then ideally they would say, yes, I want you to give me the medicine. Otherwise, it's all one-sided. It needs to be a partnership.
So one of the things that makes this class interesting is definitely the joint relationship between U of O and Peace Health. Being in a classroom on Tuesday, being in a hospital on Thursday, this partnership with Peace Health wouldn't have happened without the generous time and effort of John Holmes, who's the director of ethics.
I really am passionate about ensuring that students get that opportunity because I just feel it was so important for my development, professionally and personally. And if I can just give even a little bit of that to another student, I've done my job.
John made it possible for myself and for 3 students to be part of an organ harvesting procedure. We found ourselves in the operating room and we have witnessed the ways in which organs are harvested from a patient who was dead by brain criteria.
When you watch someone's chest being opened up and when you watch the main artery of the heart being cut and you see that the heart is still beating and you see that this person is still so much a human.
Part of me as a human felt like, wow, that heart kept going. And I cannot shake that feeling. It reminds to all of us the extent to which we are finite beings.
There are just some times in medicine where things aren't going to go as you expect, and you're going to have to make hard choices. And helping the care team sort that out is really what a clinical bioethicist can do if they do it right and they do it well.
This class has done nothing but surprise me in that I feel like it's made me more passionate about my drive to practice medicine, and it's given me more skills, both rationally and morally, to help me combat difficult aspects of medicine.
It's really important to learn about value debates, and it's equally important to realize how those value debates translate into real life situations.
So before we get into any specialized job-specific codes, you should know that almost every ethical decision you'll ever make is built on 5 universal principles. Seriously, think of these as the absolute bedrock of integrity, the foundation that's going to guide you when things get complicated. First up, the big one you've probably heard of: do no harm. Like in the Hippocratic Oath for doctors. This is your number 1 duty. Just don't do things that could hurt other people, whether that's physically, financially, or emotionally. It's the reason you don't spread a nasty rumor that could wreck someone's reputation. Simple as that. Next is its proactive cousin: make things better. See, it's not enough to just not cause problems. This principle says you should actively try to improve things. It's the difference between not throwing your trash on the ground and actually bending over to pick up a piece of litter you see just to make the place a little nicer for everyone. Principle 3, respect others, is absolutely huge. It means you treat people with basic dignity and consideration, period. It doesn't matter who they are, where they come from, or if you even like them. This covers everything from actually listening to a coworker's idea you disagree with to fiercely protecting a customer's private information. And oh man, this one gets tested all the time. Be fair. This just means you apply the rules equally to everybody. In the workplace, this is all about being impartial, giving everyone on your team a fair shot at a promotion based on their actual work, not just because you hang out with them after hours. No favorites. And finally, be loving. Now hold on, this isn't about romance. It's about acting with real compassion and kindness. This is the human element, the thing that stops the other 4 principles from becoming just a cold, robotic set of rules. It's the patience you show a new hire who's struggling, or the empathy you feel for a client who's having a really bad day. So that's the general framework that works for pretty much any job. But now, we're going to level up, because when you're in healthcare, when you're literally responsible for human life, the general rules get way more specific, and the stakes get a whole lot higher. We go from those 5 universal pillars to these 8 super specific principles. This is the absolute core of a healthcare provider's ethical code. You'll see some familiar ideas here for sure. Let's look at what these really mean, because this is where theory becomes a matter of life and death.
Number 1 is preserve life. The source materials are incredibly emphatic about this. Life is precious, and every effort must be made to maintain it.
And number 2 flows from that. Do good. This is more than just trying hard, right?
Oh, much more. It means always performing your absolute best work, using the most current, evidence-based research, and treating every single patient equally.
Regardless of their background, their insurance, or even if they're, difficult to deal with.
Exactly.
And really, what this all boils down to is that the patient is king. Respect autonomy means the patient gets the final say in their own care. That's why things like living wills are so critical.
Uphold justice. This means treating patients fairly, of course, but also understanding the legal world you're operating in. The sources distinguish between 2 major types of legal wrongs here.
Criminal and civil.
Right. Criminal laws are wrongs against society. So think of major offenses like practicing without a license, theft, misuse of narcotics.
And if you break those, the state prosecutes you.
The state prosecutes you.
Yeah.
But civil law, that covers wrongs between individuals. It protects individual rights. A malpractice suit, for example, usually falls under civil law.
You have to navigate both.
Both, while making sure you're treating everyone fairly. It's complex.
Be honest means you get their informed consent for everything, and you fess up when you make a mistake. And be discreet? Well, that means total patient confidentiality. HIPAA isn't a suggestion, it's the law, and it's a huge ethical mandate. Okay, time for the final challenge. In the real world, a bad choice isn't always just an ethical problem or just a legal one. A lot of the time, it's both. Let's see if you can tell the difference. This is where things get really tangled. You're not just dealing with your professional code of conduct, you're also dealing with the actual law of the land. And they're often woven together so tightly you can't separate them. Let's check out a couple scenarios.
For each of these scenarios, consider whether the behavior violates a law, a professional standard, or both. This helps to determine the appropriate response and consequences.
So, scenario 1, you've got a patient who just will not stop ringing their call bell. You get fed up and just start ignoring it. What do you think? An ethical slip-up? A legal problem? It's absolutely both. Ethically, you failed to do good and respect others. And legally, that's called patient neglect. You have broken your legal duty of care. What about this one? You drop a sterile dressing on the floor. Nobody's looking. To save a few seconds, you just put it back on the tray. This is a textbook example of both. Ethically, you violated be honest, and more importantly, do no harm, because now you're risking an infection. And the second that patient gets an infection because of what you did, that ethical failure just became a massive legal problem, potentially even malpractice.
Next, accidentally taking a pen and tape from work and keeping them.
You tell your best friend that a student from your old high school was admitted to the hospital for an overdose. You name them. Your friend swears they won't tell anyone.
That is absolutely, critically, both.
No gray area at all.
None. Ethically, you violated Pateri. Be discreet and respect others. And legally, this is just a flagrant violation of IPAL laws. The moment you share that information with an unauthorized person, the legal breach has already happened. It doesn't matter how trustworthy your friend is.
Finally, imagining you observe a family acting dramatically in the emergency room and later mimic their reaction to your friends during a football game. What does this reveal about your ethical conduct?
But here's the hardest question of all. What happens when the principles themselves are in direct conflict with each other? The incredibly difficult debate around euthanasia is a perfect example. You have the duty to preserve life, crashing right into the duty to respect autonomy, a patient's right to make their own decisions. There are no easy answers here at all. Which brings us to one last thought to hold on to. When the path forward is foggy and your duties are clashing, this quote from Kurt Vonnegut is a pretty powerful guide. If you can do no good, at least do no harm. It's a great reminder that at the core of every single one of these decisions is a simple question. Are you making the choice that respects human dignity, especially when it's the harder choice to make? Thanks for thinking through this with me.
For deeper learning, please check out the links provided in your materials to test your own ethics IQ and continue exploring complex ethical dilemmas like euthanasia.